I'm Eric Yazel. I'm the medical director for BluMine Health and also an emergency medicine physician in the area and a health officer. So I get to see some of the data firsthand and then go to work and see what's happening actually in the emergency rooms and also in our primary care clinics. So I've had a big kind of overhead view of what COVID-19 is doing in our area. And I wanted to talk to you briefly about the vaccine. I know there's been a ton of information out there and there will continue to be. So just a quick overview, the two main mRNA vaccines are Pfizer and Moderna. And basically what I say, those are kind of like having a recipe book and somebody slid a recipe in it to make some antibodies, and when it comes out, your immune system says, hey, this is something new we haven't seen before, let's check it out. And then when they encounter it again, they actually pose a bigger response to it. The nice thing about the mRNA vaccines is after this all happens, it's almost like a stiff breeze takes it and removes that piece of paper from the recipe book, never to be seen again. So this does not in any way change your DNA or alter anything in your body. The other vaccine is your Johnson & Johnson vaccine, which is a more traditional one that we've seen, similar to other ones that you're more familiar with. So, I think it's important to understand how those vaccines work because there's a lot of information out there as far as side effects and how well they work. And that's one thing I want to stress right now is the breakthrough cases. We hear about them all the time. I know people who have been vaccinated that have had breakthrough cases. The reality is that's less than 1% of our population right now. And the other important thing is even those folks who do break through aren't getting sick. Very few of them are going to the hospital. If you look at hospitals across the nation and in our area, it's over 90% are unvaccinated. There's a perception that these vaccines have been fast-tracked. Well, in reality, the FDA had more information to evaluate this vaccine than any other vaccine in the history of mankind. I mean, we've given billions out worldwide, millions even in our area. And so there's a ton of data on how effective it is and safety profile and things like that. There's a misperception that the vaccine is causing multiple side effects, things like infertility, or that it's breeding resistant strains. And the data on infertility, there's no sign that there's any issues with that. It's safe for pregnant moms, breastfeeding moms. And then the perception of that it's breeding the resistant strains. Actually, it's the unvaccinated population that's serving as a reservoir for the virus to mutate. And that's what's causing some of these resistant strains and making us have to add booster doses and things like that to our vaccine. So immunity kind of wanes over time, and those variant strains change over time as well. And so you're going to start seeing a discussion about a booster dose. And that's going to be 8 months after your initial series. You'll get a third dose, and that should give you another level of protection. One other area of COVID-19 that's been a topic of a lot of discussion is masking. I always get sent the video of the guy who's sanding and he takes off his mask and there's still some dust around his face as an indication that the masks don't work. I actually make the argument that shows that it does work. I mean, if somebody didn't have a mask on, think about how much would be in that area of the mask there. And that's the whole goal. It's not a perfect science. Masks aren't 100%. Nobody should be telling you that because that's not the case. But what it does is filter off a lot of those viral particles. And that's what we found over time is the amount of virus that you're exposed to is what determines the likelihood that you're going to get infected. So if you're wearing a mask, there may be a few viral particles that are still able to bypass that, but it's going to filter a lot of those and your chances of infection are going to be much less. And also on a personal responsibility level, it works the other way. None of us want to be responsible for going out and infecting our loved ones or other community members, and the masks also help from that side of things as well. It's really important that you get your information from reliable sources. Some that I think are especially useful are your state health department websites. That gives you more of a local feel. The CDC, the National Institute of Health, those are all good, reliable sources that don't have an agenda. So I can't encourage you enough to get vaccinated. Do it for your community, do it for those who love you, do it for yourself. So thank you.